I'll be teaching joints uh, on this video. If you had missed previous video, I've taught appendicular skeleton, axial skeleton, and the previous chapters. So please go ahead and review that. Um, so joints. When you talk about joints, we are talking about a point where two skeletal elements meet, and the skeletal elements are bones, cartilage, and teeth. Now, the study of joint, we call it arthrology. Arthrology is study of joint. Then kinesiology is the study of movement. Right? Joint can be classified based on structure and based on functions. So we'll go through both classification in this video. So first is I'll look at classification based on function. So we are looking at the degree of the movement of joint if it's based on function, right? So there is synarthrosis, meaning that synarthrosis allows no movement because think about it, it is synchronized together. All right, so they are immovable joints. Then we have the amphiarthrosis, which means that they allow slight movement. Then amphi means that they are joined on both sides. So when you have joints that are the bones are joined on both sides, so sort of like if you're looking at clavicle now, it's making a joint with sternum and also with glenoid, the acromion of the scapula. So those bones are joined on both sides. So even if they can't move beyond their joints since they are joined on both sides. So their movement is limited. You have the third one, which are the diarthrosis. They are um, they are usually very freely movable joints. So the acronym for classification based on function is actually SAD, synarthrosis, amphiarthrosis, and diarthrosis. Now, based on structure, we also have about three major categories based on structure. The first one had a fibrous connection. For the fibrous, it simply involves fibrous connective tissue. That's why the name is fibrous. These guys don't have cavity. So the joints are close together, no joint cavity, no bone, no cavity between the joint. There's no space there. The bones are held together by fibrous connective tissue. The second one are the cartilaginous joint. Here as well, there's no joint cavity, so the bones are held together by cartilages. That's why it's cartilaginous joint. Then the third one are the ones that have joint cavity, and these allow free movement at the joint. All right, so that's what you see in areas where there's free movement, like your shoulder joint, glenohumeral joint, the uh, elbow joint, all of the other joint, the hip joint, which is the acetabulofemoral joint. Now we are going to go ahead and look at the joints individually. All right, so the first we are going to consider is a fibrous joint. So for fibrous joints, we had said that they don't have joint cavity and the bones are held together by fibrous connective tissues. This could be synarthrosis, meaning that there's no movement, or they could allow some little movement in between them. An example of such joint is the sutures. Now, you know the sutures that we have in between the bone of the skull, the bone of the cranium. Those bones are well connected together. They are joined by thin fibrous connective tissue, and they don't allow movement. You never see any trace of movement in the bones that fuse to make your cranium. All right. So we call it synarthrosis. When replaced by bone in an adult, we call that synostosis. Syndesmosis is when the fibrous interosseous membrane or ligament connects joints together, and that is amphiarthrosis because it allows some movement. We'll talk more about that. Gomphosis is when you have joints that are when the tooth fitting into the socket, that is gomphosis. So having the tooth fit into the tooth socket at the gingiva, that is gomphosis right there. All right. Now, this general um, view of what we are talking about. If you look at this, for cartilaginous joints, again, we said they don't have joint cavity. The bones are held together by cartilage, which is why they are cartilaginous. That is what you see in the epiphyseal plate. The epiphyseal plate is the point on the long bones, like the femur, for instance. Now, there's epiphysis, there's diaphysis, then epiphysis. Epiphyseal plate is the neck region of the bone between the epiphysis, the head, and the diaphysis. That's a junction there, and that junction is filled with red bone marrow, which is actually the site of ossification. Primary ossification forms there. It's that point that determines the length of bone as bone lengthens. So it's a cartilage that is there. It's cartilage that is there, and as the bone forms and bones begin to stop growing in length, it's going to continue. It's going to remain as a physical line. Now, the pubic symphysis, like I told you when I looked at the the appendicular skeleton, is the anterior articulation of the two pubic bone, where they are held together by fibrocartilage. You remember I said that the fibrocartilage held them together at the cartilaginous point. So example of that are the synchondrosis and the symphysis. All right. So when you look at the synarthrosis, we have the sutures, like we said, we have the gomphosis. Then cartilaginous, we have the synchondrosis, which means that is where you see the epiphyseal cartilage, the epiphyseal plate. Then the syntosis is when there is conversion of the articular form to a solid mass. Uh, that is, you see it in portion of the skull, you see it in the epiphyseal area. All right, so you see it in the epiphyseal line. Okay, now cartilaginous. Again, cartilaginous joint. That's synchondrosis, like we said, the bone are connected by hyaline cartilage. It's synarthrosis because it does not require movement. It does not allow movement. Epiphyseal plate growing long bones, the joint between the ribs and sternum, which is held together by cartilage. You see that these blue are cartilages. So the joint between the ribs and the sternum is a kind of um, synchondrosis. Then we have the symphysis. Symphysis again is the bone joint here. This is symphysis. I told you it's the anterior connection, anterior articulation between the two hip bones. You have the intervertebral disc and the symphysis, the pubic symphysis. This is intervertebral disc, and this kind of joint allow very minimal movement. We call it partial movement right there. They don't allow feel-through movement, but they allow some movement. Now, this actually is an error. Here is fibrous joint. All right. So here we have fibrous joint here. Fibrous joint. All right. So we have fibrous joints, not cartilaginous. So fibrous joints, they have cavity in the joint. That's why we call them fibrous. They are, sorry, synovial rather. The synovial joint. Let me clean this. These are the third category of structural classification, and we call them synovial joint. Synovial joint, not fibrous joint. It is synovial joint. All right. So the synovial joint, like I said earlier, on the first category, I told you there are three joints. The synovial, the fibrous, the cartilaginous, and the synovial. The synovial is the one that have joint cavity. The bones are held together by a capsule and ligament. And I'll show you their diastrosis mean that they allow free movement. That's a joint you see in your knee, in your temporomandibular joint, in your shoulder joint, in your hip joint, the elbow, interphalangeal joint. That's the joint that it's synovial joint. Again, synovial, not cartilaginous. All right, not cartilaginous, but synovial joint. Now you see the joint here. This is a synovial joint, and you can see articular cartilage over here. You could see um, synovial membrane here, and this is the joint cavity where the synovial fluid will be secreted. And you may have noticed that some people, when they have injury consistently at their knee joint, that sometimes they need to refill the synovial joint there, the synovial fluid there, if it has leaked out due to the impact of the injury. All right, so those people will get injection here where they will be putting the synovial joint there, and that happens like every 6 months thereabouts, depending on the impact of the accident. All right. So we say that synovial joints, they are the kind of diastrosis because they allow very free movement on them. And we say that is the only joint that have uh, cavities. All right. Then synovial cavity is what is there. Then it will be surrounded by synovial membrane. And the purpose of the synovial membrane is to secrete uh, the serous, the synovial fluid, the fluid into the serous fluid into the membrane. All right. Now, articular soft capsule enclose the synovial cavity and it helps in uniting bone together. It has two parts. It has a fibrous capsule and the synovial membrane. Now, fibrous capsule is the outer membrane there. So you see, when you look at the capsule, you see the fibrous joint capsule. So this is the outer one. Then you see the inward one, which is the synovial uh, membrane right inside there. It's made up of areolar connective tissue, that's some elastic fibers, and some adipose tissue as well. Now, we have in here as well, you will see the articular cartilage. And here's the articular cartilage here, like I pointed earlier, that's the articular cartilage. It prevents direct contact between the two bones so that the two bones are prevented from friction. All right, so they are kind of hyaline cartilage and they cover articular surface of the bone to protect the ends of the bone. Now, the synovial fluid that is secreted by the synovial membrane is what um, helps to fill the cavity. Like I told you, some people will need it replaced if it has been uh, impacted by trauma. It also lubricates the joint, it nourishes the articular cartilage, and also it helps with immune function, able to pack out or degrade the bacteria or any foreign substance that enter into the joint. Okay, so we have a joint. There are ligaments. All right, there is extracapsular ligament and intrascapular ligament. Extra means that it's outside the articular capsule. Inside means it's inside the articular capsule. The articular disc is menisci. They are part of fibrocartilage, so which is there. I told you that fibrocartilage are the weight-bearing area. So you have fibrocartilage in the you see it at the pubic symphysis, you see it at the intervertebral disc, you also see it at the knee joint. Also, the knee joint also have articular cartilage, which is a type of hyaline cartilage. So it makes a better fit for the bones, and it also adds stability to the bone. Now, bones are sac-like structures. They help to reduce friction between bones, skin, tendons, muscles, and ligaments. Inflammation to the bucci is what we call bursitis. Now, what are the kind of movements that these joints make? The first one that I will talk about are the gliding movement. We have the gliding movement, we have the angular movement, we have the rotational movement, special movement. So I'll take it one after the other, but very fast. The gliding movement simply means that there is a bone gliding on a surface. All right. So it simply means that there is a bone that is gliding on a surface. All right. So the surface of one bone moves back and forth, gliding and side to side over a flat surface. All right. Now, in this point, there's no angular movement and there's no rotational movement. This is what you see at the wrist. And you will notice that when you look at your wrist is able to go right, left, I mean, front and back, right, left, front and back, right, left. So it's gliding on the surface of the ankle, I mean, of the radius and ulna. That is what you see on that other joint. The second kind of joint is the angular joint. And when you look at the angular joint, angular movement rather, there is an increase or decrease in the angle between the bones. Now, what we call flexion means that you are reducing the angle, and extension means that you are increasing the angle between the two bones that are joined together. So if you look at this now, when you are looking at joint, either flexion or extension, you are focusing on the joint, the origin. Now, so if you are looking at your upper limb, for instance, your upper limb, when you flex your elbow, currently this is 90 degree, 180 degree. When you flex your elbow, you are reducing the angle at this junction. So this is reducing the angle, and that is flexion. When you restore it back to where it was, to the original 180, that is extension. So extension does not mean increasing the angle. Extension simply means to restore the angle. That's simply what extension means. It simply means to restore the angle. All right. So if you look at this now, this here is the hip joint. Sorry. If you look at this, here's a hip joint here. Now, if you this hip joint normally is 180 degree. When you flex it, you are reducing the angle. If you return it back to where it was, you have extended it. Again, extension means restoring it to where the angle existed before. Now, there are some joints that you can extend and now also take it beyond where it was. When you restore the angle, like in this case now, when you restore the angle, you can also push it beyond where it was. So looking at this, if you flex your knee, your elbow, it goes this way. The angle here is now reduced from 180. Now, when you want to restore it, you are going to restore it and it comes back to 180. Now, you can decide to go beyond the 180 backward. This is what we call hyperextension. So hyperextension simply means that you are taking it beyond the normal region or the normal position in the body. Now, angular movement. Angular movement simply implies that you are making movement at an angle. Now, so when you see my digits now, they could be together. If they are together, we call it addition. Oh, so it means adduction. Adduction, hard. It's been all added together. Now, when you separate it, you have abduct, abduct, and think about it. The word abduct means to take away. So you have abduct from the middle line. So adduction, adduction means that you are moving the object towards the middle line. You've added everything together. Abduction means that you are taking it away, separating it. Now, circumduction is simply movement around the circle. And the joint that does that in our body is the shoulder joint. You are able to circumdut your shoulder joint. All right. Now, rotational. Every You can rotate your head to the right or to the left, so you can rotate. You can rotate. Now, the atlantoaxial joint helps you to do that. This is what we call, if you are rotating it, so we have right rotation, lateral rotation. You see that? Right rotation, left rotation. This is right rotation if you're moving it to the right. Left rotation is if you move it back to the end. Now, there is something we call internal rotation or medial rotation. Medial rotation is simply this. You are tucking your hand in. This is internal rotation or medial rotation. And if you turn it outside, it's lateral rotation or external rotation. You can do the same thing with your foot. You can turn it inward, pointing to the other one, internal rotation or medial, pointing away, lateral rotation or external. Now, there are some special movement we call depression and elevation. Now, when you decide to move your jaw down, this is depression. It's not being depressed, it's just depressing, like lowering the jaw. Then you can decide to tuck it back up, and that is what we call elevation. Now, retraction is when you push it up, push it to the front, like you're doing like this. This is retraction. This is protraction. Retraction, protraction. If you push it to the front, protraction, push it back, you are retracting it. Retraction, like I will retract my support. You have taken it back. Now, these are inversion. Inversion is so when you are taking your when you take your um it's more like you're doing medial rotation, right? So inversion is you are tucking your upper limb inside. So I mean your foot, right? You turn it inward, inversion. Inward, you tuck it inward is inversion. So inversion is movement of the soles medially at the intertarsal joint so that they are facing each other. That is inversion. Then eversion is when you are moving it outside or laterally. That is inversion. Dorsiflexion is when you bend the foot superiorly at the ankle. Now, this dorsiflexion is close to flexion. So when you are flexing the ankle, we call it dorsiflexion. When you extend the ankle, we call it plantarflexion. Now, don't forget that flexing the ankle, this is special for ankle. Flexing the ankle, dorsiflexion, extending the ankle, plantarflexion. Now, supination and pronation. When you say you want to have you in a supine position, when you get to the clinic, the doctor usually asks you to sit in a supine position. Supine position means that you are facing up, right? Everything is up. And I joke with it that supine means up. And you see the up here, supine, up, right? Then pronation is the opposite of supination. Now, opposition is what you do when you pick this pollex, when you pick it and you use it to touch each of the other fingers, that is what we call opposition. It's simply the pollex you are moving to touch each of the other fingers. Now, let's look at this point. We are going to look at the types of synovial joints. We're going to look at the planar, the hinge, the pivot. I'll look at that real quick. All right. So if you look at the glenoplanar planar joint, this predominantly is a kind of joint that moves side to side and back and forth. Now we say that it is a monoaxial joint because it moves in one direction. The kind of joint you see here are the intercarpal joints, the joint between the carpal bone, intertarsal, the sternoclavicular joint. It can only move in one axis. That's the sternum and the clavicle, the vertebrocostal joint. They can only move either this way, That's vertebrocoxonal. Between patella and femur, it can only move in that direction as well. Then the hinge joint are the joint that you see. We say they are concave surface of one joint. Now think about the hinge. The hinges are the door. The door are held together by hinges to the frame. You see how the door can close. The door cannot make a circular movement, so it only moves in one axis. One axis is that it can open and close. All right, that kind of joint we call it the axial joint. It can flex and it can extend, and that's what you see in the new joint. You see it in the elbow, in the ankle, and in the interphalangeal joint. Um, you have the pivot as well. The pivot is a kind of joint that you see between the axia and the atlas. Now, it's the joint that helps you to say no. Like I said earlier, that's the joint that helps you to say no, and that is the joint between the axia atlanto-hasia joint. It helps you to rotate your head, rotation, and it is also monohasia. It is in one axis. Now, condylar joint is the joint that's what you see. Uh, it's a biaxial joint. It's when you see the radiocarpal joint, the radius and the carpal joint. That's the joint there. That's the joint you see between the metacarpal phalanges, the joint between the metacarpal and the phalanges. And then the same joint you see between the metatarsal and the phalanges. They are able to move um, they are able to circumduct. So you do circumduction at those joints, you see, you can circumduct it and you can circumduct. You can abduct it, you can adduct it. Again, you can adduct it, you can abduct, you can circumduct. So it's bihazial joint, not just one axis. Then we have the saddle joint. The saddle joint is what you see on the first carpal metacarpal joint. So the carpal metacarpal joint, this is the metacarpal, this is the metacarpal, and this is the carpal. So the one as you have the trapezium, the trapezium here, and the pollex here. So the joint that the trapezium and the pollex make at the metacarpal is what we call a saddle joint. So it's the bone, the joint like slide on the bone. So we call it saddle joint. All right, they are able to flex, extend, adduct, abduct, and circumduct. You see that? Now, ball and socket joint, this is a predominant joint in our body. That's a joint that happens. I was telling you when I was teaching, is appendicular sclerosis, how the humerus, the head of the humerus, fits into the glenoid cavity of the scapula. That is ball and socket joint, and that's what you see right there. The same joint is what happens when the head of the femur feet into the glenoid into the acetabulum of the hip bone. That is ball and socket joint. It's like a ball fitting into a socket. And this kind of joint, you see it in shoulder joint and hip joint. Again, shoulder joint means glenohumeral joint, and hip joint is acetabulofemoral joint. You are able to flex this joint. You flex, you can extend, you can flex. All right, you can abduct, take it away. All right, you can adduct, bring it back, you can rotate it, and you can also circumduct it. So we call it trihazial joint because it can go in almost all directions. Now, injury to the now in cases when there are injuries to joints or when there are inflammation or any kind of movement, any kind of inflammation or trauma on the joint, some joints get to degenerate over time because the cartilage depreciates or degenerates, wears out. Um, they can also cause production of bone spurs that restrict movement. After a joint is stationary for a long time, that can also be a problem. Now, gouty arthritis is when there is deposition of urate crystal that has formed crystals and build up in the joint area. This is going to cause inflammation. So it's built up of material. It's simply built up of material, which are waste products, and they're going to form crystals. They cause inflammation and swelling. At the point, because of the kind, because it's Catholic, right? It can cause the bone to fuse, and this can occur in mutant H-men with an abnormal gene. Rheumatoid arthritis is when there's autoimmune disorder where the white blood cell attack some articular cartilage by itself. Now, this can lead to inflammation, swelling, severe pain, can lead to deformation of the extremities, and eventually fusion of the joints can also happen. Now, the other one that is very key is the Lyme disease. The Lyme disease is when there is a bacterial infection that is transmitted by deer tick. That's a host. That's a host, the vector that carries the bacteria. It will lead to joint stiffness. It will lead to fever, chills, headache, stiff neck, and it first associated with Lyme, Connecticut. Ankylosing spondylitis. This is when there's inflammation due to some syndrome that are not known. It's caused by unknown factor. But the major thing that we do is that it will cause the joint between the vertebra and it will affect the joint between the vertebra and the sacrum and also the hip joint. All right, then we have the ankle sprain. This is most common to be most common joint to be sprained or fractured. Treatment include RICE, which is rest, ice compression, and elevation. Now, the last thing is cases is the issue of aging, the effect of aging and on joints. Now, as we age, it is normal that synovial fluid that is secreted by the synovial membrane will depreciate like decrease. And over time, because of usage as well, the articular cartilage that is like a paddle, like a like pad, the joint is going to start to become thin, and then there could be loss of some ligament length and flexibility. In this case, arthroscopy will be helpful. It's joint examination using instruments to measure the size. Instrument like a pencil that allows the use of tiny instruments and a tiny microscope to evaluate the joint. A small incision through which repairs can be made also will be made, and then repairs can be done at that point. The cartilage that are damaged can be removed, and it can be replaced either through autograft, heterograph, isograph, as the case may be. Arthroplasty is when there is replacement of a joint. Hip joint, knee joint, and shoulder joint are usually commonly replaced. And what happens here is that the articular element is what is replaced here. Yeah, some people also just replace it by plastic or stainless steel. And that's what you see there. You should have seen this commonly in people. Right. I'll see you in the next chapter. If you have not seen my previous chapters, please go ahead and watch them. It will be very helpful. Thank you.